Hello all, I am Dr. Walter from SNS College of Physiotherapy, and so today we are going to see a new topic based on monoplegia. Okay, so you might have seen the other YouTube videos regarding all the neuro conditions, and today also we are going to see a new condition based on the plegia. So what is plegia? I'll explain in simple, that is paralysis. So what is the other name for paralysis? Paralysis means it is the weakness. Okay, now what is monoplegia? So it will be affecting any one of the limb. So we'll go in detail what will be things which is present, what is the prognosis, and what is the clinical conditions. All these things will be learning. Now, definition: it is a paralysis which is affecting the single limb. Okay, either it may be an arm or a leg. Okay, now going for the types is divided into types, that is spastic and the plastic. So spastic means completely going for rigidity. Now we are going to see the types. Types means spastic and the flaccid. In other cases, we will be going for, in rare cases, complete monoplegia and incomplete monoplegia. So what is spastic? Spastic means rigidity, and flaccid means going for the reduced muscle tone. Okay, and what is about the complete and the incomplete? So complete means total loss of the movement along with the total area, that is either the arm or the leg. Now going for the incomplete, that is partial, either one part of the arm or one part of the hand or wrist. Okay, in same it will be applied to the legs also. Now going for the impact, so daily activities will be a little more difficult for these types of patient. Now going for the etiology. Okay, so what is etiology? Now stroke, it is completely called as a stroke, and it will be also coming under the conditions for the peripheral nerve lesions and for the spinal cord injury and also for the brain tumors. So these are the types of etiology which will be occurring. So the patients who are entering into any these types of conditions will be going for the monoplegia. Now clinical presentation. So what is the clinical diagnosis, and all these things will be going for the motor weakness. For example, if I am going for a monoplegia, so my hand is going for a monoplegia, so that I cannot able to do the movements, that is the wrist movements and all these things, the flexion or extension. Okay, muscle tone abnormalities. So for example, so I am having the left hand and the right hand. For my right hand is going for the monoplegia, and comparatively for the left hand, this hand the muscle tone will be very less when we are calculating based on the muscle tone assessment. Going for the sensory changes. Sensory changes will be going for the pain sensation, touch sensation, it will be diminished for the areas of the monoplegia. So differential diagnosis. Other than this, what will be happening in the differential diagnosis? Either it will be classified into hemiplegia or a paraplegia. Now going for the next one is the physiotherapy assessment for the monoplegia. So as we are taking this video and as we are learning for the physiotherapy, now we need to give a clear understanding about the physiotherapy assessment, how we are going to assess this patient. So subject to history, and based on their all the details, that is the age, sex, their past history, their present history, and what about their past medical history, their family history, all these things will be coming in. Objective assessment. So especially for the neurological patients, we are having a special assessment chart for the monoplegia. Okay, so this monoplegia assessment chart we have learned already in the previous class. Now what is going for the functional assessment? Functions is going for the all the movements, that is the aerial activities. All these things, aerial activities is nothing but the things which we are doing to the day-to-day life, like eating, combing our hair. Okay, so all these things going for the aerial. Goal setting. Now last, we need to find out a proper way to differentiate all these things into a proper goal setting. And the last one will be going for the principles of the rehabilitation. So principles, so with this we are going to complete this one. The principles is called the early intervention and the progressive overload and the task oriented training and the patient centered care. So as a physiotherapist, we need to conquer all these four categories as one, and we need to deliver the proper rehabilitative treatment. Okay, so with this video we are completing the monoplegia. Thank you.